This is Africa TV and you are watching the World Today News Bulletin on Africa TV. I am Amadou Kante. Many thanks for coming along. Now, the Africa Center for Disease Control, in collaboration with the World Health Organization, look up to the next stages towards the adoption of the herbal medicine for the COVID-19. An expert advisory committee on traditional was launched on July 22nd by the Africa's health governing body. Details of that in this report by Sona Tunkara.
In addition to the 64 clinical trials for COVID-19 conducted 2 weeks ago, there are currently 24 new candidate vaccines undergoing clinical evaluation under the arrangement of Africa Center for Disease Control and Prevention. Globally, 142 candidate vaccines are in preclinical evaluation, including 4 in Egypt. A consortium for COVID-19 vaccine trials of more than 80 potential sites was launched by the Africa Center for Disease Control and Prevention. Out of those, one has been finally approved to be tested on a COVID-19 candidate with no side effects, according to reports. Dr. John, director of Africa CDC, emphasized on the importance of the African continent taking the lead to fight against the virus with the adoption of traditional medicine.
And I think that was a very powerful statement that we as a continent want to promote traditional medicine and remedies as part of a possible solution to this. I've always maintained that the solution to fight against COVID-19 will be based on innovation. And we don't know where that innovation will come from. So we have to approach it with an open mind. Second thing is that traditional medicine and remedy in Africa is widely used, and we should promote it and encourage it. Similar to what China does. I mean, if you go to many medicine stores on the continent, you see nice packages of China traditional herbal remedies, and I think that is a good example of what we as a continent should be doing. However, we should make sure that there are at least a couple of things are met. That is that the safety of the remedy is ensured, that the efficacy of that is ensured, and there's standards applied to that.
Madagascar is the first country to introduce the traditional medicine cure for COVID-19, after which several African countries, including the Gambia and Senegal, receiving donation of the COVID organic few months ago. Although the innovation is yet to get approval from the World Health governing body, the Africa CDC is very positive for the prospect of herbal medicine in the continent. In the midst of the insensitive nature of the coronavirus, considering the humongous population of Uganda known for the existence of the deadly Ebola virus, the country has recorded a cumulative number of cases standing at 1,622 with zero fatality rate. The director of Uganda National Institute for Public Health, Dr. Alex Arias, says Uganda is battling simultaneously with COVID-19 and Ebola.
And right from the time when COVID was declared a pandemic by WHO, it actually found us already in the preparedness, in the response phase of COVID-19, of Ebola. And so we simply transitioned to preparedness and response to COVID-19. So by the time we got the first confirmed case of COVID-19 on the 21st of March 2020, we were actually fairly prepared. But of course, it takes a lot of resources to respond to COVID-19. So we used a multi-pronged approach to respond to that.
Over 7,600 clinicians have been trained in clinical management of COVID-19, and gene expert cartridges have been deployed to Chad, Sao Tome and Lesotho during the past week under the arrangement of the Africa CDC. Meanwhile, the global number of cases has risen about 14 million with nearly 600,000 deaths as of this week. There have been an increased percentage of 19, which translates to over 700,000 new cases with more than 15,000 deaths reported in Africa. For our Africa TV, Sohna Tunkara.